Welcome back and thank you very much for staying with us. The Giyani Municipal area in Limpopo is not a COVID-19 hotspot. That's according to Health MEC Dr. Ramathuba, who today visited the area to assess hospital admissions statistics as well as readiness to admit more patients. There have been social media reports that infection and death rates in the rural municipality have been skyrocketing in the past few weeks. Pimani Baloyi and cameraman Musa Mamaila joined Ramathuba on a tour of the Nkensani Hospital.
We're at the Nkensani Hospital in Giyani, Limpopo, where Limpopo Health MEC Dr. Ramathuba has just had a tour of the hospital. The visit follows several media reports, social media reports that, the area the greater Giyani Municipal area has been experiencing high numbers of infections, COVID-19 infections and deaths. But you know what? We've been to the hospital with the MEC and we've seen the COVID-19 ward. We've seen a lot of the facilities. And what we've learned is that since the start of this pandemic, this hospital has treated about 107 COVID-19 patients, and about 15 of those at this point have died, and the remainder have recovered and have been sent back to their homes. So, to speak more about how this area is looking, but to put in more about some information about that, the cumulative numbers that this greater Giyani area has from the stats that are given by the National Department of Health daily shows that this area has only had just about 1,500 infections with about 24 deaths since the start of this pandemic. But to speak more about how this area is looking and what her impressions are, we are joined by Dr. Ramathuba. MEC, you've been to this hospital. There are reports that the numbers are plummeting. What has been your impression?
I think what we need to appreciate is the fact that one death is too many amongst our community members. So when you record 15 deaths, for instance, the period of the current resurgence from the 1st of December up until this particular weekend, we have recorded 15 deaths out of the 197, almost 200 admissions, and only 15 have lost their life. So the problem is that 15, it's a huge number. So hence people see it not acceptable. I've analyzed all the 15, and I can tell you it is only one who is around 47 years, less than 50. The rest of them are over 70. And that tells you, and all of them, including the one who's less than 50, had a comorbidity, diabetic, hypertension, even renal failure. So you could see that they fit the picture of those patients who were afraid should they get infected. So in terms of the numbers, one of the issues that might be, which this is our thinking, is that you might find that because a number of people here in Giyani are working either in Tzaneen, some are also working in Polokwane, and also working in Gauteng. Now what happened is that when you consult in Polokwane, you then use your address of your flat in Polokwane, and therefore you are recorded as a statistics of Polokwane. Even the death, if you die, because we have got a number of deaths that has happened in both Polokwane, two major private hospitals, and also in Tzaneen, a private hospital. So when you look at all those numbers, you might find that on the ground, people see them as death in Nkensani Hospital. But truly speaking is that as the numbers that we have of those tested here in Nkensani and also in the private sector around Giyani, they are not what people are saying. And also if you look at the statistics here, Giyani is number 3 in terms of the municipalities around Mopani. It's not even number 1. The municipality leading, it's Greater Tzaneen. And the municipality seconding, it's Baphalabura. And then Greater Giyani is number 3. But of course, we do understand the fact that people are treated in other municipalities, in other provinces, but demised in those provinces. And then when we bury them here, we are burying them in Giyani. So communities will say we had 5 funerals in this particular township, and not forgetting that only one might have happened in Nkensani.
But MEC, does that mean that people are dying from their homes? Do you have figures that speak to people? There is a belief that rural people don't seek medical attention and people are self-medicating. Is there evidence that this is the case?
What we can tell you is that there is evidence that the 15, I will say 13 out of the 15 that died here seek medical attention late, because they arrived and within 12 hours they had gone. Some died on arrival. So it's clear. We are still waiting for the statistics of Home Affairs. Remember, it was festive season, because on a monthly base and quarterly base, Home Affairs give us statistics of death that has been recorded within the Giyani Municipality. So for now, since we had a resurgence, they have not yet collected that statistics and given to us. So once we get that statistics, because what we usually do is to look at the number of deaths registered by Home Affairs and the number of actual deaths that we registered in our facilities. So we'll be able to look into that. Prior the resurgence from November down there, we have not had any challenges. The numbers were fine. That is why we were saying, as a province, we have got the lowest infection rate, because even the people that are dying on the ground, you wouldn't see them like it's happening now. That's why now we're saying we are on a resurgence, because we see the increase in terms of number of deaths.
And MEC, moving away just slightly from the statistics, you've toured this hospital for a number of hours. You've interacted with some of the patients who are on queues here. You've interacted with the staff. There are challenges, and most of them were raised to you. Can you take us through some of those challenges and what your solutions would be like in the next few days?
I think the first issue that I must indicate, to be honest and truly speaking, our soldiers are tired. There is fatigueness. Our nurses, our doctors, our cleaners, they are exhausted. Not just physically, mentally they are drained. To nurse COVID patients, especially those that are on continuous oxygen, those who are on high flow oxygen machines, really it's draining if you listen to those staff there. And that is the major issue, which is because the tiredness and the fatigue is not only at a hospital level, it's up to a provincial level. Then you would see that hence we are now starting to experience some gaps. The gaps that I'm referring to also are worsened by the fact that you are having more of our healthcare workers sick. People who are now getting infected, you will see how many cleaners today, I'm told, are on quarantine, how many porters are now on quarantine. One cleaner was telling me that she's also a porter and a cleaner because the porter is on quarantine. She has to do work. If you look at our filing, only 3 employees are on duty today. The rest of them, they are currently on quarantine. That's why you see there's a long queue there. So what solutions on those issues is the issue of getting the temporary COVID-19 staff. Even if we give them 6 months, it's a matter that we have to fast track to make sure by the end of this week, we should have done that. We know it's going to be a mammoth task because we know our communities, how they're going to be to say they want us to appoint everybody, which is quite impossible. For now, we want to focus on getting people to get the job done. The second issue that we have also noted, which is the third actual, because it's fatigue, it's shortage, coupled with shortage, and there is an element of some of the wards not having PPEs. Certain items of PPEs. You'll find that they've got surgical gowns, they've got sterile gloves, they've got N95 masks, but they don't have boots, and they had to improvise. So that is one area which, for now, it has to be attended to, because the impression and the reports that we got was that these particular items are there, they are there, they've been delivered to the facility. So we were told that we've got a 2 months buffer stock up to so far. So we need to know whether it's the management here in this hospital that has not done their work, whether it's the pharmacy manager that has not done their work, but that we need to deal with. The other area is that we want to encourage our managers. I still want to reiterate that when you get to work as a CEO, the first thing you do with your team before you even enter your office is to go to all your COVID-19 wards, your isolation ward, and where the patients are admitted, and interview your staff. They must tell you how many patients they've admitted, how many demised. They must tell you PPEs which are running short, and you yourself make intervention. If you don't do that, you are going to be shocked, because the report that you are getting from your immediate supervisor is the report that they want you to know. That is why you see some of us are not sitting in our office, even if people blame us to be tourists, because I don't want a report that I will be given. The report becomes colorful and it's decorated, whereas the material conditions that our employees are going through on the ground, it's a different story.
Thank you so much, MEC. That is Limpopo Health MEC Dr. Popi Ramathuba, just taking us through what she's observed here at the Kensani Hospital in Giyani. But for now, it's back to you in studio.